Hello, I'm Dr. Amy Schreibman. I'm a nurse practitioner and a doctor of nursing practice. I want to welcome you to Medical Minutes today. We're going to talk about dementia, but it's going to be a two-part series. There's so much that we need to know and learn about dementia. It's such a lengthy topic that we wanted to break it up in two parts. So today we're going to talk about what exactly dementia is and some types of dementia, and then in our second part series we're going to talk about ways to prevent dementia. Dementia is a term used to describe severe changes in the brain that cause memory loss. However, the changes in the brain also make it difficult for people to perform basic activities of daily living. And in most people, dementia causes changes in behavior and personality. To be considered to have dementia, mental impairment must affect at least two different brain functions. Dementia may affect memory, thinking, language, judgment, and behavior. Dementia is not a disease. It may be caused by a variety of illnesses or injuries and can't be reversed. Alcohol and drug abuse can sometimes cause dementia as well, and in those cases it can be possible to reverse the dementia in the brain, but reversal happens fewer than in 20% of the people with this type of dementia. Today we're going to talk about 4 different types of dementia: Alzheimer's dementia, vascular dementia, Lewy body dementia, and mixed dementia. Alzheimer's disease is the most common dementia. According to the Alzheimer's Disease Association, 60 to 80% of dementia is caused by this disease. Early signs of Alzheimer's disease include depression or depressed mood, forgetting names, and recent events. However, depression is not a part of Alzheimer's disease. It's a separate entity and must be treated specifically. Occasionally, depressed older adults are either diagnosed as having Alzheimer's disease by accident. Alzheimer's disease is characterized by brain cell death, and as the disease progresses, people experience confusion, mood changes, have trouble speaking and walking. Older adults are more likely to develop Alzheimer's. However, about 5% of cases are early onset Alzheimer's and occurs in people in their 40s and 50s. The second most common type of dementia is vascular dementia, which is caused by lack of blood flow to the brain. Vascular dementia can happen as you age and can be related to atherosclerotic disease or even a stroke. Sometimes vascular dementia can appear slowly or suddenly depending on the cause. Confusion or disorientation are common early signs. Later on, people also have trouble completing tasks or concentrating for long periods of time. Vascular dementia can also cause vision problems and sometimes hallucinations. Lewy body's dementia is caused by protein deposits in the nerve cells. These deposits interrupt chemical messages in the brain and cause memory loss and disorientation. People with this type of dementia also experience visual hallucinations and have trouble falling asleep at night or fall asleep unexpectedly during the day. They also may experience fainting or become lost and disorientated in their surroundings. Lastly, there is a mixed dementia, which refers to the situation where a person has more than one type of dementia. Mixed dementia is very common, and most common combination is vascular dementia and Alzheimer's disease. According to the New Jersey Alzheimer's Association, up to 45% of people with dementia have mixed dementia but don't know it. Mixed dementia can cause different symptoms in different people. Some people experience memory loss. Some have disorientation at first, while others have behavior and mood changes. Most people with mixed dementia will have difficulty speaking and walking as the disease progresses. It's absolutely normal to forget things once in a while. Trust me, it happens all the time. Memory loss itself does not mean you have dementia. There is a difference between occasional forgetfulness and forgetfulness that is caused for serious concern. Potential red flags for dementia include forgetting who someone is, forgetting how to do a common task like brushing your teeth or using a telephone, or finding your way home, inability to comprehend or retain information that has been clearly provided. Seek medical attention if you experience any of these above symptoms. You will likely consult with a neurologist who is a physician who specializes in brain disorders. There is no cure for Alzheimer's disease, but research strongly suggests that there are ways to reduce the risk of dementia. By identifying and controlling your risk factors, you can minimize your chances of not having lifelong brain health and take effective steps to preserve your cognitive abilities. In our next segment, we're going to talk about the 6 pillars of prevention. If you have any questions or comments on what we discussed today, and if you have a topic that you'd like to learn about, please leave them in the comments section below and we'll get back to you. Please tune in next week for a second part on dementia. Remember to follow us on Facebook or on our website, The Vocal Voice. I'm Dr. Amy Schreibman, and see you next time on Medical Minutes.